We are a national nonprofit that works to protect children from environmental hazards in the environments where they live, learn, and play. And as a leader in the Childhood Cancer Prevention Initiative, I'm honored to moderate this session today. This is part of helping to bring attention to Childhood Cancer Awareness Month. The Childhood Cancer Prevention Initiative is hosting a series of educational panels as part of our re-release of the report, Childhood Cancer Cross-Sector Strategies for Prevention. I would like to thank my fellow key leaders and organizers of this week's sessions, Deborah Ernberg and Aniana White with the Cancer Free Economy Network, David Levine and Devika with the American Sustainable Business Council, Ann Robertson with Toxic Free Futures for Our Children, and Jonathan Agan with Prep for Bold. This report calls out how toxic chemicals are hurting our children, in particular exposures to pesticides, air pollutants from vehicle emissions, paints and solvents have scientific evidence of contributing to various forms of childhood cancer. And what we do know is that since 1975, the incidence rates of childhood cancers have been steadily increasing. And we do know that these exposure routes are very much connected to these environmental exposures, such as pesticides. For this panel, we are focusing on pesticides and childhood cancer prevention and have a great set of leaders here today to share some key actions and solutions that they have been working on to protect children from environmental hazards. Our first speaker will be Bertha Lewis, who is a community organizer and the founder and president of the Black Institute. Bertha has worked tirelessly as an activist and community organizer for over 25 years. She's the former CEO and chief organizer of ACORN, an influential national organization that mobilized urban communities at the grassroots level, fighting for their needs for over 40 years. Bertha has fought for immigrant rights by advocating at the city, state, and federal levels. She's been an integral part of the low-wage workers campaign to guarantee higher pay, paid sick days, and family leave. Bertha has also worked with developers to create a landmark community benefits agreement to secure affordable housing, living wages, local hiring, and training programs for the community. Most recently, Bertha has led the charge in advocating for minority and women-owned business enterprises in New York City. After Bertha will be Jay Feldman. I've known Jay now for better part of 2 decades, which is amazing. He's the co-founder and executive director of Beyond Pesticides, a service that he has provided for over the last 40 years. Jay dedicated himself to finding solutions to pesticide problems after working with farm workers and small farmers through an EPA grant in the late 70s to the national advocacy organization Rural America. Since that time, he helped to build Beyond Pesticides' capacity to assist local groups and impact national pesticide policy. He has tracked specific chemical effects, regulatory actions, and pesticide law. He is very familiar with local groups working on pesticides and has helped to develop successful strategies for reform in local communities. After Jay will be Ángel García. Ángel joined Coalition Advocating for Pesticide Reform, or CPR, as their core staff in 2017. After working for the coalition for more than 3 years as a staff member of the Lindsay-based nonprofit El Quinto Sol de America, he became organizing director in 2020 in Tulare County. As a Tulare County native, he graduated from USSC with a BA in Latin American and Latino Studies and Politics. He's the founder of the local coalition, Tulare County Coalition, advocating for pesticide safety. And finally, we will have Emily Marquez, who has been a staff scientist at Pesticide Action Network, where I've been the board chair, and she's been there since 2012. Emily earned a Ph.D. in biology from Boston University, where her research interests were comparative endocrinology, reproductive development, and endocrine disruption. Emily works in PAN's grassroots science program, translating science and managing PAN projects such as air monitoring using drift catcher with frontline community members. And with that, we are going to get started with Bertha. Let me share my screen.
Well, hello, everybody. We'll have our slides up in a moment, but let me just tell you a little bit about how we came to this. The Black Institute was created in 2010. And we had 4 buckets. One was the environment. as it affects Black people and people of color, also education, economics, and immigration. But we did a report in a few years back called Poison Parks. Since we were in an urban environment, we said, okay, you know, where do low and moderate income people go and what do they do? And urban parks, this is our outdoors. This is where we go. And so we did Poison Parks report. Next. And, you know, we've always done grassroots campaigns. Politics is everywhere in everything. And once we did this report, we said, okay, how do we take action through the study of this, real civic engagements and political engagements? So next, our Poison Parks report. Ergo, what we said that we would examine was the use of chemicals, mainly herbicides, in all of New York City's parks. The one that we focused in on was glyphosates. Now, you all see commercials about Roundup, you know, when you have your suburban front yard or backyard, you need to kill those weeds and you spray Roundup. This harmful, poisonous chemical is used throughout New York City parks. It had been produced by this giant chemical corporation, Monsanto. And I think some of you have heard of that. They are huge. And we studied this and we went to the International Agency for Research on Cancer. And at one point they said, well, this is probably carcinogenic. We all know that when people say probably, they mean that it is. Glyphosates have been linked to non-Hodgkin's lymphoma, all kinds of cancers, kidney disease, birth defects, and especially asthma in children, but also cancer in children. Our next thing. But what we focused on here at the Black Institute, how does this affect Black people, people of color? And we found that, okay, no surprise, these chemicals are disproportionately used in communities of color. There's a park called Roy Wilkins Park, huge, beautiful. That park in Queens, New York, if any of you know New York, it is a predominantly Black and brown neighborhood. 100% of Roy Wilkins Park was sprayed with not just glyphosate, but concentrated glyphosates. Now, usually in New York City, you spray between 2 and 3%. But at another park in Queens, we found that glyphosates were sprayed from 33 to 50%. Again, it is surrounded, Idlewild is surrounded by a community that's 90% Black. Harlem, everybody knows where Harlem, USA is. They were sprayed dramatically more. 50% of all the parks and playgrounds where children play, were sprayed more. So we know that this is a prime example in New York City of environmental racism. So let's go to the next one where we talk about the implications of the spraying. Tens of thousands, if not millions, of New Yorkers are exposed to this every day. City workers that do the pruning, the gardening, 77% of all city park workers are people of color. They are directly exposed. It's predominantly when you transport and truck this stuff, not only is it sprayed in our communities, but it goes through and is transported in our communities. You know, you've got South Bronx, you've got other neighborhoods. Hospitalizations are up with childhood asthma rates. The air is toxic because of this. But no surprise, white, wealthier neighborhoods, they don't have the same impacts that we have. Not only are our communities being unwittingly exposed to all of this stuff, they're just rife with toxins. Plus, they're hit harder, hit everywhere. And we, as people of color, low and moderate income people, we have the least resources to combat this. And you would think in New York City, you would have data galore, but guess what? The Parks Department in New York City, they don't report their data consistently. If they're poisoning people, is it any wonder? So, next slide shows you just a little map of where each one of these are. In the Bronx, Newtown Creek, Hunts Point, in Brooklyn, Prospect Heights. Prospect Park in Brooklyn is one of the biggest parks that there is. It rivals Central Park. You've got Roy Wilkins, which I referenced earlier, Harlem, of course, Washington Heights, a predominantly Latino neighborhood, Port Richmond, Arlington, in Staten Island. This is where people of color are concentrated. But what was our solution? We decided in the next slide to fight back. So we said, listen, this is environmental racism. This is racial herbicide spraying. Many of us fell prey to COVID-19 because we already had these underlying conditions because of our neighborhoods. I mean, we couldn't just be quarantined at home because we were already exposed to this. The other thing is, when you are poor, when you're middle class, when you're moderate income, when you're Black or brown, you know, we can't go out to Martha's Vineyard. So when we want to have something enjoyable outside, we go to city parks. But when you lay your blanket down on that beautiful green grass, you are sitting, breathing, rolling around in poison because it has already been done just to get rid of some little weed. Glyphosates weaken the immune system. We know this. And this is because COVID-19 is a global pandemic, and we also know that it has hit countries of color the most. We've got another thing where we said, you know what? Black and brown employees, Black and brown residents in New York City are going to be exposed to this, whether they are aware of it or not. So what do? Next slide, we just fight back. So our solution, along with other folks that formed the coalition, was we said we have to pass a law, 1524 in 2019. Now, there was already a local law 37, that said, you know, you can't spray toxins, you can't spray poisons in the park, but it didn't specifically say who and what. And so we amended local law 37, came up with intro 1524. 1524, we are very proud to say, banned all pesticides and glyphosates being sprayed in public park. And guess what? It passed on, of all days, unanimously on Earth Day in 2021. So that is a way that you can take action But what can you do? The next slide. So the one thing that you can do is to check out our Poison Parks bill. We think that if we could ban these glyphosates, Roundup being sprayed, that you could in fact do this all over the place. You know, we think that anywhere that you are, you should demand an integrated pest management that is organic, that you can use non-chemicals to do this. And also wherever you are, demand that your officials give you accurate and real reporting. We would be more than happy to help you with being able to fashion legislation from your local city council the way we did here. So what do we want you to do? You can check out our Poison Parks report on our website. Just go to thebblackinstitute.org. In our next slide, you can read our Poison Parks report. You can also look at Intro 1524, how that was constructed, what we did to use the law to protect us. We are building a coalition. You know, join our coalition. We have a petition that you can go to. And also in our website, you can find out how to contact us, whether you want to know, how do I fight in my local area? What's going on in my local area? Are they spraying in my local area? What am I being exposed to? But more importantly, like our subject matter today, what are your children being exposed to? We're all going through this thing now of, you know, children being subjected to COVID. Well, some of these children, you know, were ripe for any variant of any virus. So if you want to protect yourself in the future, protect yourself now. So again, we're happy to be here to answer any questions that you might have after all of our panelists speak. And we want you to take action, whether you just read the report, whether you try to find legislation on your own, whether you join our coalition, whatever it is, or just contact us. This is what you can do, because trust me, if it's going on in New York City, it's going on all across the country, and especially in a lot of rural areas that you don't think gets that way. So thank you.
Thank you so much, Bertha. And I know a lot of folks are very excited and are already writing in the chat box about you know, the importance of what you've accomplished and the modeling potential. And thank you so much. I heard an offer among many that you might be willing to talk with those who want to learn some best practices and get some of this done in their locality. So thank you for all of that. And we will make sure that all of these links are again provided in some follow-up for those that are interested. And obviously this is being recorded and the recording will be shared. So thank you, Bertha. And now Jay Feldman.
Thank you. Yeah, and this is a great victory. What the Black Institute has done in coalition with groups throughout the city. And I think it really is on the leading edge of what we need to do as a country and as a global community. Our efforts really stem from the early days when Silent Spring was written. And the reason I put this up here is because cancer is an important entry point. It gets people thinking about where there's deficiencies and the protections that we deserve, the disproportionate risk, the elevated cancer rates in people of color communities, the elevated rates of diseases we'll be talking about. But it starts with the environment in which we're living and recognizing the complexity of that, the biological systems, and recognizing, as Rachel Carson said, there are alternatives, sort of puts this thing in perspective. We also know, having experienced the last 2 years, that unless we begin talking about systemic change, how we fundamentally change whole systems, what is structural change, we're not going to solve childhood cancer. I mean, there's a recent study that just came out. It's a meta-study that really shows that in utero exposure and acute leukemia is elevated in children and growing and associated with pesticide exposure. So from our standpoint, you can apply this to cancer, you can apply this across the board when it comes to pesticides. We have to, and this is from both the community perspective and the state and federal policy level, that science is an integral part of the discussion. So the report that CEHN is putting out is a critical piece of empowerment in that science needs to be brought to these discussions, as it was in New York City. We also have to recognize that regulations in place currently are politicized. And as a result, we're not really protected by science. And that unless we address some of these issues, we are in effect seeing irreversible public health threats and the looming the climate crisis. One of the things we're trying to do is connect public health issues with larger environmental issues. And by doing that, bring communities together. So when they're working on a climate action plan, they understand that the impacts of the chemicals going into the deterioration of the climate or climate crisis are the same chemicals that are adversely affecting health directly from exposure. Undue corporate influence, we see at the local level, we see it at every policy level at which we work. And I think the story out of New York and other communities, which we'll touch on, is that this is a bottom-up solution. This is a bottom-up approach. We have to focus on local decision-making in the absence of adequate protections at the state and federal level. The other thing that I think this issue shows is there is an intersection between the decisions that are being made in our community on local land management, how are we managing our parks, and the actual chemicals that are being used, whether it's glyphosate or it's toxic insecticides. You know, these are chemicals that have impacts that are carcinogenic, neurotoxic, reproductive toxins, and so forth and so on. So we have to, I believe that we have to school ourselves and work with those decision makers to give them an out and say, well, what else can we do? We want to have beautiful parks, we want aesthetics, we want good playing fields, et cetera, et cetera. What are the solutions? You know, when we talk about pesticides, we're not just talking about glyphosate, the active ingredient. We're actually talking, as Bertha mentioned, we're talking about Roundup, which is a formulation. And in that formulation, we're talking about all kinds of ingredients, some of which are not actually on the product label. These are called inert ingredients. And that's a longer story, but this is part of the empowerment piece in a local community discussion on how we're managing our parks. What are we actually exposed to? And what do we know about those chemicals that we're exposed to? And when we look at the overall chemicals, including glyphosate, we're actually updating this. It's now 40 commonly used lawn pesticides or turf landscape pesticides. 16 are likely probable carcinogens, right at the top of the list. Then we have endocrine disruptors, which you all know is related to cancer and other long-term effects and chronic diseases, reproductive, kidney, sensitization, respiratory toxicants. Same thing with environmental impacts on groundwater. We've all heard about the bees, the butterflies, and birth defects such as this among amphibians. So if you step back and look at the scientific literature, what we have seen across the board, and it's quite astounding when you put it all in one place, which we've done with this pesticide-induced diseases database, is you see these epi-studies. So yeah, you can see the studies and the determination of cancer among children, among the general population, and then you can look at the epidemiologic studies that look at these same results. And so we've gone back and looked at all the studies and organized it in this database. Again, a tool for people to bring to their local decision makers to say, look at these chemicals that we're using in our community and their association with cancer and different types of cancers. I mentioned acute leukemia. in a recent study. And that's the kind of data that goes into this database. But here's the rub. You know, as Nse mentioned, we've been at this for a long time, and you can't miss, if you look at the historical trends in this area, you can't miss the fact that we have been debating banning, researching, debating, banning, researching chemicals for since Rachel Carson wrote Silent Spring in a pretty rigorous way. And we've gone through the arsenicals, the arsenic-based pesticides, DDT, chlordane, all these organochlorines, chlorpyrifos, most recently banned by EPA for food uses, but still remaining uses, believe it or not, golf courses, wood preservatives, medians, and other uses for mosquito management. So what do we do when we get the science and we finally convince a regulatory agency to take action? Well, we move on to the next chemical. That's how we ended up with glyphosate. That's how we ended up with the neonicotinoids. Imidacloprid here is a insecticide, a systemic insecticide, probably the largest, most widely used insecticide in lawn and turf management. It's a persistent chemical. It has dramatic environmental impacts, particularly on bees, and it also has impacts on human beings. Triazines, widely used in agriculture and in some landscape management as well. So we need to stop this whack-a-mole approach, right? Moving from one set of chemicals to another set of chemicals. And in having this discussion, as we did with the New York City Council, we need to explain that not only are we making this mistake of not questioning, and here's where the systemic change comes in, not questioning the underlying dependency on these chemicals in these land management systems, but we're doing a bad job of looking at the chemicals when we do look at the chemicals. And we explain that, you know, we're not looking at chemical mixtures. We're not just exposed to glyphosate. Glyphosate and imidacloprid, they're all used together. And there's this interaction often with these chemicals. I mentioned the inert ingredients, the ones that aren't on the product label. They're just labeled as other or inert ingredients. We don't actually look at endocrine disruption as an endpoint yet, even though Congress demanded and mandated that EPA set up a protocol for this in 1996, we still not have completed the protocol at EPA. So we're not looking at a major endpoint that is critical. We could do a separate conference on endocrine disruptors. And we're not asking the questions of chemical use as Rachel Carson employed us to do in the context of complex biological communities. So we throw a chemical at a problem, there's a weed, we throw the chemical at the problem, and we don't look at the environment in which that chemical is being used. And as a result, we create bigger problems. We create weed resistance. We create insect resistance. We create problems that are even more difficult than the ones we started with. So we as an organization have shifted our focus. Yes, we define the problem. Yes, we empower the robust community-based discussions on the hazards, the deficiencies of the regulatory system. And now our challenge is to bring that passion and enthusiasm to our discussion of land management. How do we manage land in recognition of the public health and environmental threats? And this is where we are talking about a systemic change and solution to eliminate petroleum-based pesticides, to build these coalitions at the local level, which bring in the climate activists, which bring in the ecologists that are concerned about the insect apocalypse, which bring in the cancer researchers, which bring in the child advocacy organizations, and talk about land management and how a failure to recognize complex biological communities has this ripple effect throughout our communities. There's really good research on this that shows the value of what we get in return when we look at land management from a systemic perspective. Not only do we get the carcinogens out of land management, we protect the biodiversity, we minimize water use, we increase profitability, we recognize ecosystem services. And this is another thing that the Poison Park report really zeroed in on. Landscapers, we don't think about landscapers as being the high-risk population in a city environment because they're handling these toxic chemicals. They're not protected, they're not trained, and they're highly exposed, and they are disproportionately people of color. So we have replicated the failure of our food production system to recognize the value of farm workers with the failure of our landscape management system to recognize that we need to protect our landscapers. So the interconnections here are really powerful and important. So we did move from integrated pest management, which, by the way, does not have a definition. Notice when Bertha said integrated pest management, she added the word organic to that phrase. We have been failed by industry co-opting terms. We know this in our organizing experience. And integrated pest management has been co-opted. Regenerative is now being co-opted, not because there aren't good people attached to those terms, but because without an agreed upon definition, what we have done is we have undermined standards that are enforceable and a list of allowable materials that have been scrutinized and systems planning and getting to the systemic changes that are necessary. So we've segued into managing these fields organically. This is a great story. This is a field up in Massachusetts, totally organic. I showed up there unannounced, beautiful. We can have beautiful fields, just like we can have beautiful food with that. So we have now moved into this area of land management. What does it actually mean? What do we as cancer scientists, as agronomic scientists, as children advocates, as people of color who are concerned about disproportionate risk, what do we all have in common when it comes to land, and how do we need to manage this land? So we've been schooling ourselves, we're working with horticulturalists just like we work with organic farmers, and we're bringing these principles to the management system. We look at soil texture, we look at the basic soil chemistry, and here's where what we do, and this is taken right out of organic, what we do that is not done by the New York City Parks Department. We look at what's going on in your soil. What is that complex biological community? How do we work with nature? How do we feed that soil to get the kind of beautiful turf and management that everybody deserves, no matter what their color is, no matter where they live in any place in America? And it goes to cultural practices, not just product replacement. We have to start thinking about working with nature in ways that support the natural balance, the ecosystem. And this is all driven by our concern about childhood cancer, about endocrine disruption, about neurological disease, about essential workers who have elevated respiratory diseases, weakened immune systems, weakened nervous systems, and are greatly, their exposure is so off the charts relative to the average population of someone like myself who has the luxury of sitting at home during this pandemic and not being exposed to COVID on top of the underlying conditions that I might have. So this is where New York City is leading. We're codifying these management plans, and we're specifically putting in, as New York City did, specific reference to the code. I'm sorry, the code, here we go. The code that identifies the allowable materials. This is where organic's different than IPM. We point to a list. You know, the first thing we learned when we went to local jurisdictions, they said, we don't have the resources, we don't have the expertise to make these decisions. We said, you don't need it. This is going on at different levels of government, local, state, federal. There are lists, there are evaluations. They're in 7 CFR 205.602. They go, well, what's that? We print out the list, point to this list. 25B, listed exempt pesticides. What's that? We point to the list. Now, there are always going to be waiver provisions as there are in New York City. We're struggling with that. We're improving all the time. As we say in organic, this is continuous improvement. And this discussion is happening across the country and even in Hawaii. Now, Hawaii actually took it a step beyond New York City. This was passed in August of this year. They basically said, we're going to step back. We hear you on soil, land management, and we're going to only allow materials allowed under federal organic law. So that includes allowed pest management tools, as well as allowed fertility, allowed fertilizers. because the one thing we've learned about all of this is that unless you think, and we're learning this on social issues, I mean, we've known this for a long time, unless you look holistically and systemically and look at how you support that ecological land management system that makes our local park, you will be feeding fertilizers, what we call soluble nutrients, to those plants, and that will undermine the health of those complex biological communities. So that's what we're doing with New York City now. Wow, that is an amazing transition for us as an organization, but also for local groups who come in there and say, I want to protect my kids. I don't want my kids exposed. And they get this pushback like, well, we don't have a choice because we need beautiful parks and we need playing fields. And at that point, we have the burden to bring the technical resources to the Parks Department, to the local housing authority. We're working with a co-op in New York City and Queens, beautiful landscapes, all chemically managed, to that board of directors to say, you don't need to use chemicals in that environment. And this is a beautiful thing, and we're joining with the Black Institute to bring this across the country and recognize the high risk. Montgomery County, Maryland, 1 million people, same thing. One last thing I'll leave you with. You've heard from this talk and others, you'll hear there are great deficiencies in the way these chemicals are regulated. Unfathomable, unacceptable deficiencies. And when we talk about a community, we're talking about public spaces and private spaces. And years ago, we started this work and we started working on public and private land in a community. So if I own, I'm in a housing co-op and we own some land, or I have a backyard, front yard, in most states, the local city council is prohibited from restricting pesticides on my private property because the chemical industry went to the state government and said, you need to preempt these local jurisdictions from controlling what goes on within their jurisdiction on private property. Now, we don't do that on recycling. We don't do that on dog waste. We don't do that on zoning. But guess what? As Bertha said, there's a lot of power behind the chemical companies, and they have gotten virtually every state legislature except for the state of Maryland and Maine and 4 others. And so we've gone to the local jurisdictions in Montgomery County, Maryland, and said, you have the authority to restrict what goes on to protect all the children. So if they're walking down a street, they don't get hit with drift. If they're playing in a schoolyard or the schoolyard's next to a garden or a farm, they don't get hit with drift. Their local community can regulate. And we need to go to every state legislature and get them to allow the democratic decision-making process to work as was intended so that we can protect our children, our waterways, our local ecology. And that's happening in Montgomery County. And it's happened, we have 2 models in South Portland, Maine, where they've done the same thing on public lands and private lands. So I leave you with the fact that we are entering an age, and we must enter this age of a precautionary approach. We're not going to have all the information. We don't have all the information on mixtures, on elevated risk factors, but we have enough information to know that we are harming sensitive populations. We are harming people with disproportionate exposures and risks. We are harming the environment, and we can take a precautionary approach. And this is what New York City has done. They've done it in the face of resistance from chemical companies and from people who have been trained to rely on these toxic chemicals. And folks, this is a new day. It's a real opportunity. And I thank the Black Institute and organizations like the Black Institute across the country, which are the driving force in local communities. So if you want to check out more on this topic and hear all the people we think inform local action, you can get on our last conference, which took place in May and June of this year. Click on this link down here, or just Google National Pesticide Forum Beyond Pesticides, and you'll get the underlying science that drives these incredible local organizations like the Black Institute, which is obviously working nationally as well, to affect these changes. Thanks so much.
Thank you so much, Jay. As usual, very important information. we need systemic change. Jay emphasizes to stop looking at one chemical at a time. We know that our regulatory process has been completely broken, if it was ever fixed at one point, which I don't think it was. And obviously looking at, you know, the cumulative effects that community members, especially vulnerable populations, are dealing with. So really appreciate those positions and those examples, and the link to the last conference. Very helpful. And now we will have Ángel, and I will share my screen real quick to get your slides.
All righty.
Right.
Well, again, good afternoon, everyone. Name is Ángel García, the organizing director with Californians for Pesticide Reform. We are a statewide coalition of more than 180 organizations. And I do want to also highlight that we have organizing presence in California's Central Coast, as well as California's Central Valley. And for those of you that are not familiar with these are regions with great farm worker presence, and oftentimes what a lot of the agricultural pesticide is mostly used or is heavily concentrated in. Our mission at CPR is simple: protect public health and support efforts that address local pesticide policies. And so if we can perhaps go to the 2 slides ahead in the interest of time, that would be great. So just quickly, UCLA, as already noted in the CCPI's 2021 addendum, one of the studies illustrated the link that exposure to pesticides may increase the risk of childhood leukemia, and the other more recent study revealed that proximity to plant nurseries may increase childhood cancers. So one of the things I want to definitely highlight about these 2 studies is that both of the studies look at up to 2.5 miles from where pregnant mothers live, expectant mothers live. And I think that's a very important takeaway from these 2 recent UCLA studies, because if, for those of you that have an opportunity to come out to the Central Valley or to California, or maybe have an opportunity to sort of join those discussions, a lot of the communities here are either adjacent to fields that are heavily sprayed with agricultural pesticides, or are in very close proximity to areas where they use agricultural pesticides. And we're talking about homes, we're talking about schools, we're talking about churches, we're talking about daycare centers, we're talking about families here. And so I think that one of the, and so when we're talking about 2.5 miles with these meta-analyses that came out of the UCLA recently, I think it's really important to also gauge the distance, because this really sort of illustrates that a lot of our families are not beyond 2.5 miles away from these fields. They are very much closer. And so that is very alarming. Next slide, please. And briefly, I've gone ahead and just wanted to share this slide. This is from the first UCLA study, this one focused on childhood leukemia. And I want to bring your attention to the following. At the very bottom of the 6 pesticides that were looked at, 4 of the 6 pesticides have either been banned or are not approved for use in other countries. Take, for example, Diaron. 29 other countries have either banned or have not approved this pesticide. If we look at paraquat, dichloride, for example, an herbicide, 48 other countries have either banned or not approved this chemical. If we can maybe go to the next slide. Thank you. And so similarly with the first study, the second study, the one that focused on childhood brain tumors, we have a similar trend. 7 of the 8 pesticides that were looked at have either been banned or not approved for use in other countries. Specifically, dimethoate, it's an insecticide. 33 other countries have either banned or have not approved its use. Or propiconazole, 28 other countries have either banned or not approved the use of this chemical. And so this really gets us thinking that in addition to the major findings of both of these recent UCLA studies, our current regulation system allows for chemicals like these to be used in close proximity to families, to farm workers, to quote unquote essential workers. And it's really important to take that into mind when we're talking about pesticides, to really humanize the studies and really humanize that these are real lives that we're talking about. Next slide, please. And so to continue on this topic, we're looking at California. If we're to look at the average acres on which this type of pesticides linked to childhood cancers, there's been overall an increase in the average acres that this type of chemical was used on. For example, carcinogens. From the sort of time frame of the 1998 to 2011, we're looking at roughly 8.9 million acres that this type of chemical was, or carcinogens were used. But if we look at a more recent sort of time period, 2012 and 2018, that number has actually gone up rather than going down. And it sort of really coincides with CCPI's findings and also in their recent also study. Next slide, please. And so in addition to that, there's been evidence of exposure in other California studies or efforts. For example, UC Berkeley Chamaco's wristband study from summer of 2016 detected phosphate on 10 and diamethite on 13 of the 97 Salinas Valley teenage girls who wore the bands for 1 week. That's it, yeah. And then also in the same year, in 2016, a study by Martin Boudou for France 2 TB found propiconazole and diaron residues in the hair samples of all US children it sampled, including 5 residents from my region, the Lindsay Tulare County region. And this really puts forth this idea that my colleague Bertha put forward earlier in her portion. Next slide, please. And that is, one more, environmental racism. So this perhaps helps to illustrate that point. There are 2 charts here. The chart on your left is of counties that have, it's of 11 counties in California that have its overall population over 50% being Latinx. The chart to your right is of 25 counties that have less than 24% of its overall population be of Latinx. And so what we see here is that Latinx communities are disproportionately harmed by current pesticide regulatory system. The system is not doing enough to protect our communities, our farm workers, our essential families from pesticide harms. And yet we do have industry groups, we have those that like to champion or boast that we have the most robust system in the nation. And yet if we look at the data, which by the way has been extrapolated from the Department of Pesticide Regulation's own database, as well as other state agencies, we see a different picture. Next click, please. And so to put that into perspective, the 11 most Latinx counties have 1,205%. That is 12 times the amount of cancer-causing pesticides per person as the 25 least Latinx counties. This is what I mean when I say environmental racism. This should not be happening in 2021. Next slide, please. And so this is also echoed by allies and champions across the nation, or I mean, across the state. Take, for example, Dr. Antonio Velasco, who was at the forefront back in the 80s in getting some sort of pesticide field posting ordinance. So he expresses the following: my hope is that the Monterey Bay will once again take the leadership of toxic pesticide warnings with a 21st century version of the 1981 Monterey County Pesticide Field Posting Ordinance, this time adding posts on the digital web in addition to the posts on the ground. So that is to say that in the immediate, given the current regulatory system, one immediate step that communities are doing here in California, farm working families, organized communities, is demanding their right to know. Next slide, please. And so my ask for the listeners and viewers here today is the following. Please, on the sort of more state California level, write to California's Department of Pesticide Regulation. As Jay mentioned, we need to stop this one bans that are usually one at a time and stop playing this whack-a-mole sort of approach. Because bans, pesticide bans take a long time. Take DDT, for example, 10 years after Silent Spring was first published. Or there's also methyl bromide use, which continued at high levels in California, excuse me, more than a decade after international ban. And most recently, we have brain-harming Chlorpyrifos, which took over 20 years of scientific warnings. And so we cannot wait any longer, and we can't do this alone. We need everyone. We need all of us in this. And in the meantime, at the more hyper-local level, communities are also demanding their right to know what, when, and where pesticides will be applied so they can take precautions. Here in the Central Valley, there are a lot of families that still use swamp coolers. The AC units are not very pervasive here. You still have swamp coolers and it's sucking in all the air from its surrounding and it's going into people's homes. And there's also, right now, there's really no way to find out what is going to be applied ahead of time. And the state of California, yes, it started a process towards a statewide pesticide notification system, which is hopefully what sort of is a timeline of, with a timeline of July 2024, but that's just simply too long. We can't have families wait till July 2024 to see something. So right now, what we're asking here at the local level and across the state and the different organizing regions that we have, that county ag commissioners receive notices from growers about plant applications of the most hazardous pesticides to web post that information now. There's nothing that prohibits them from doing so. And it really needs to happen because people want to take precautions. So quickly, please sign on our online petition. You can visit us at pesticide-reform.org. And then we also very much welcome any letter of support. And so that'll end my part, and see us for taking longer.
Thank you so much. And Emily, share slides also.
Oh, and say I was going to share the screen.
Oh, you're just going to do yours. Okay.
Yeah,
Excuse
so
me.
that, because I realized I made a little mistake on that.
Okay. Okay, please.
Thank you.
Thank you.
Okay, cool. Wait, where's the slideshow? Sorry. Okay, thank you. Thanks, Nsei and everyone. So I'm part of PAN North America, and I'm based in Berkeley. And I'm PAN North America is part of a global network that was founded in Malaysia in 1983. And we have 5 regional centers that we coordinate and work with as part of our international work. So childhood exposure to pesticides generally has been shown to increase risk of cancer. But today I'm going to talk about PAN's work in coalition with many other groups on a neurotoxic pesticide called Chlorpyrifos. And this is in part to talk about you heard from several speakers, or the preceding 3 speakers, how the system is broken. And Chlorpyrifos is a really almost a perfect bad story about how the system is broken on regulation of pesticides. And I'm going to talk about this work in the context of PAN's 3 core capacities, which are grassroots science, strategic communications, and organizing. So this neurotoxic pesticide, Chlorpyrifos, it's an insecticide. It's infamous for its adverse effects on children's brain development. So in 2001, household uses of Chlorpyrifos were withdrawn by EPA because of the threat it posed to children's health. So exposure indoors, like crack and crevice treatments, became evaluated as too dangerous for children to be exposed to. And I don't have this date on here, but in 2007, PAN joined a lawsuit with Earth Justice, NRDC, and several other organizations like United Farm Workers, and then a group, I'll stop there, but there were several other groups that were party to the lawsuit, asking EPA to take action on Chlorpyrifos and evaluate and look at the risks to children's health in that context. So this took a long time for any action to be ordered. Several years later, there were some orders made by the Ninth Circuit Court, but we can just fast forward to 2016. The EPA proposed to withdraw all food uses based on epidemiological or public health data. In 2017, the EPA under Scott Pruitt reversed that proposal to withdraw food uses of Chlorpyrifos. And then PAN went back to court, but there we go. Okay, so that's a bit of an abrupt transition, but I'm going to pause the story there, and I'm going to go back to talk about how PAN used these 3 core capacities in various ways. So one way at PAN, we call it grassroots science. We've done air monitoring using the drift catcher with community members. And 2 of our most powerful projects we're actually looking at Chlorpyrifos and air monitoring with farm worker families in Washington State, and then in Lindsay, California, in the Central Valley, where Ángel's based. The Lindsay project was really powerful because PAN also did biomonitoring in partnership with Commonweal. And this was a very convincing project for regulators to hear about, because we had both the air monitoring, the exposure, and then after took human samples, urine samples mainly, but also breast milk from a few participants, and found Chlorpyrifos in there. So we had both the exposure and the Chlorpyrifos showing up in the bodies of the farm workers who lived on these frontline communities. And obviously this level of evidence is not accessible for pretty much for most people, but this was one of our most powerful projects because we got a buffer zone policy to pass in Tulare County, and then after that several other counties in California followed suit with Chlorpyrifos buffer zones. Another area of grassroots science that we do is translating studies and sharing that information with the public. So these are 2 children's health reports that I worked on with Kristen Schaefer, our executive director, talking about public health studies of various aspects of children's health, and 2 of the most powerful bodies of evidence were on brain development in children, or effects on brain development and childhood cancers. We also do strategic communications. So this is done by getting folks to sign petitions. We do social media. We do, online organizing things, actions, and also promoting important journalism stories, news stories that help tell the story of the pesticide system and why it needs reforms. We also blog, and this is all, to both get the public engaged and to learn more about the issues around pesticides, but also to pressure legislators at the state level or EPA and Congress on a national level at times. PAN also does organizing, mainly at the state level, but because Chlorpyrifos had such a outrageous, decision taken on it in 2017 after the proposal of a ban on agricultural uses, there was also national legislation proposed to ban Chlorpyrifos specifically. This is extremely rare. I don't even know if there was such a thing before, happening before, and then there's also been a lot of state legislation. So in 2017, bills to ban Chlorpyrifos were introduced in the House and the Senate, and then also communities in several states pressed for a Chlorpyrifos ban. So Hawaii was the first state to ban Chlorpyrifos. New York State was next, and then California banned Chlorpyrifos uses except for use of granular formulations. So then we have the so-called end of Chlorpyrifos. EPA is going to ban Chlorpyrifos on food, and this just happened in August. And the uses will expire in early 2022. But the decision was not based on epidemiological data. And this is an important point because there is a huge amount of public health data on Chlorpyrifos. And though EPA has definitely used epidemiological data, the Office of Pesticide Programs tends to avoid it. They do avoid it, not tends to. And the Office of Air Pollution, for instance, used public health data in their decision on regulating particulate matter 2.5, PM 2.5. But the Office of Pesticide Programs is really taking a different track. And this is concerning because public health data is valuable. Maybe over the past couple of years, we've definitely learned a lot about why public health scientists are so important to promoting good, policy on health issues. And so this is a problematic direction. To sum up, science is necessary, but it's not sufficient alone to be cause for action. There's over 20 years of data on Chlorpyrifos, well over 20 years, and yet it took that long, starting from when EPA acknowledged that there was a problem with the threat it posed to children's health, to actually do something about it. And so we used communications, organizing, and then finally, of course, legal action, which got us, I guess, to this point. But as Jay said, going one pesticide by pesticide is really problematic. And we have this act that is legislation, national legislation to help reform FIFRA. So this act is called PACTPA. It's the Protect American Children from Toxic Pesticides Act. It's a bill proposed to overhaul US pesticide law and strengthen it. Some of the things that are in the bill, for instance, it would ban organophosphate pesticides and paraquat, the really toxic herbicide that Ángel mentioned, and it would ban those outright. And then there's other areas that would be strengthened, loopholes that sort of were missed by FIFRA, which is the current pesticide law. So you can read more about PACTPA on this blog. That's the first link. If you want to hear more about it as it comes up in legislation, you could get updates on PAN's work on PACTPA and other aspects of pesticide work. And that's the sign up link, the second one. Okay, thank you.
Thank you so much, Emily. Thank you to all of our speakers. We clearly needed more time, but I think the whole point of at least introducing, in some cases to you, some of these great efforts happening, and in others, many of you do know the great work of these groups, but to hear a lot of the specific actions that they're working on in ways that we can all contribute. I've been taking a lot of notes on how not only the Children's Environmental Health Network, but also the Childhood Cancer Prevention Initiative, Cancer-Free Economy Network, which many of us are a part of, can be certainly aligning better our messaging, our efforts, our engagement, so I think there's a lot of great follow-up here. As a reminder, this is recorded, so we will get the recording out. We do encourage folks to, let folks know about it. I believe these will be up on the Childhood Cancer Prevention Initiative site. Either way, we'll let everybody know. Sorry we didn't get to too many questions, although I didn't see any get posted, but if you do have any even after today, just send me a note. I'm sure our great colleagues here would be happy to try to answer what they could, even by email. Thank you all so much. This is a lot going on. As Ángel said, there's no way we should be dealing with any of this in the year 2021, almost 2022. Our children deserve so much better today and into the future. And I'm going to continue to be the eternal optimist that we can do better and take this window of opportunity that we do have, this narrow window, and try to do all the best that we can for communities across the country. Thank you all so much. Be well.